Nice deep breath in. This time all the way out. There we go. And some chest openers to get some flexion, extension, and rotation in that spine, specifically the thoracic spine. But today we're dealing with some right hip, right knee, and looking at the leg lengths. We've got a little bit of a short right leg, but the hip looks a little high on that left side, so that to me is saying sacrum. Motion palpation, that's moving beautifully, and right here, you feel the difference in that? Real stuff right there. So we're going to start with some Flexion-Distraction, really just trying to hydrate the discs. It's motion, it's the only way your joints get any type of nutrition. So we're just going to do some nice deep breathing in with the up and out with the down. And you just let me know if I'm too rough, okay? So a lot of times I'll notice tension kind of bounce from side to side on the body. I'm feeling a lot of tension in this left low back, so that does make sense if you're having some pain. Oh yeah, a little tender right there?
Yeah.
Okay. Tension in that glute med, that hip. We have different fascial planes that kind of run along the body and the back, so we'll definitely do some dry needling to address that and really just try and loosen up these muscles. When I apply pressure up here, we're just focusing on the disc kind of right below that segment. And really this is just about getting some motion into the spine, nothing super crazy. Nice little warm up before we get into the adjustment. And I just like to work my way up the spine, kind of feel where there's a lack of motion in those segments. Here we'll probably just cue in some music, you know, do a fast time lapse. So between the right mid back up here and this left low back right here, what are you feeling more?
The low back.
The low back? I'm feeling a lot more tension in there too. So we're gonna bring out the big guns. So there's a few different ways you can loosen up the muscle belly. One of the ways I like to loosen them up is through vibration. So it's really just sending some proprioceptive signals, trying to get that muscle belly to relax. It's just going to make it a little less uncomfortable once we get the needles in there. Have you been doing more walking, more work on the farm lately?
Yes, and
Yeah.
moving stuff.
And moving stuff.
Yep.
So a lot of times, especially if we're starting to walk more, we'll get a lot more trigger points in the hips, specifically the glute med, because regardless of whether, you know, it's you're toeing off in the gait cycle or you're hitting on that heel, the glute med is either exerting or absorbing that stress. So it's very common to get some trigger points. So if you don't have somebody to, you know, massage gun them out, I like to get a lacrosse ball, maybe a tennis ball, pin it up against the wall and just kind of shimmy my hips back and forth. And I always like to work the muscles that are supporting that pelvis. So we're going to get into this piriformis here as well. I'm just working right around all the muscles that attach to that greater trochanter on the femur. So I just like to hook onto this trigger point, apply some moderate pressure, and then as that trigger point releases, we should just slide right off of that. And we'll just do a few more passes to make sure we got it. We're gonna do some drop table for this low back. Perfect. Let's check. Nice and even. That motion palpation. Perfect. And we're moving. The drop tables help us get more speed with the adjustment, essentially. So we can use less force to get that same adjustment and cavitation. I just felt that motion right there, so we'll just get a little. Yeah, beautiful. Nice deep breath in and hold. More tender here or here?
Right.
Right side? Okay, same thing. Nice deep breath in. This time all the way out. There we go. And I just want you to spread the elbow out just a little bit. That helps move the scapula out of the way so we can adjust these rib heads. Beautiful. Okay, and your neck is actually feeling really good. I feel some right here. That's the only thing. Have you been getting any headaches?
No, not really.
Okay, perfect. Want to loosen up the SOT muscles and the paraspinals, especially on this left side. Beautiful. So Missy is a great patient. She already knows the drill. Whenever she feels that tension, she just breathes into where she feels that. And then with that exhale, just like that muscle lets go. Part of it is just bringing that mind-body awareness. Can I just have you wiggle your toes, please? Perfect. Okay, beautiful. And just like that, we're all done.